Hi, I'm Jennifer McCarthy, and I have the privilege of serving as your Chief Operating Officer here at Maine Medical Center. Think of where you were the first, second week in March, and we were spending all of our time watching TV, trying to figure out what was going to happen with the global pandemic.
Now have the new criteria that we're using?
On March 10th, we decided it was time that we really take action. And we stood up at Maine Med what is called our Incident Command Center. And that began the very long process of caring for the COVID population here in Maine. On March 12th, we saw our first patient. And within a week, we had not only figured out what we thought was the absolute best way to take care of our patients and to keep our staff safe, but also where were we going to take care of these patients. As you can imagine, at our high point, we had somewhere close to 70 extra patients here in an already full hospital due to the pandemic. If it hadn't been for the Coulombe family and for other donors, we would not have been able to take the pressure off the state like we were able to do. The Coulombe Family Tower, 2 floors on top of the beautiful mother-baby suites, were built for our oncology population. Within a week, we sat down with our oncology leaders, our infectious disease physicians, staff, other providers, and decided where was the best place to take care of the COVID patients that were coming. We very quickly moved 64 patients out of that new Coulombe Tower, and we dispersed them throughout the hospital. And we were able to then take what are called universal rooms, the rooms that people who designed this building had the foresight to recommend that could take care of any level of patient, regardless of acuity. And we moved all of our ICU patients up into the 6th floor of the Coulombe Family Tower, where we were able to then open up our existing ICU and serve that in a very dedicated, closed away, contained space for the COVID patients. That happened in a matter of a week. We could not have done that. We could not have cared for the numbers that we cared for here at Maine Med without these 2 additional floors.
You know, you talk about decisions in life, a right turn versus a left turn, and where you might have ended up.
I knew Wednesday night we were in trouble because it took that long that his lungs had actually solidified.
This past Friday is when he tested positive for COVID-19, and now he's located at Maine Medical Center. He's in a medically induced coma on a ventilator.
He was definitely dying, and there were times when they said, you know, we want to be hopeful. We always have hope. They never took that away from me. Everybody that I was talking to, they were human beings first. I just kept saying, you got to keep trying. I don't care what you do. You got to keep trying.
It's been taking a toll on all of us, not being able to be there with him.
I think about the team and the staff there a lot. Sorry. But they really ended up being my family.
I know that Sammy's holding that phone to your ear.
They would take their personal cell phones when Pete couldn't talk, he was still intubated, and they would be sure that I could say something to him so that he could hear me.
You are healing, you are making improvements and strides. You have the best care in the world.
You know, there's not one single thing you can point your finger at, right? It's the sum whole of it all. I really am just so fortunate that there's people out there that give of themselves, you know, for that. You know, they were there for me, and they didn't even know who I was, right?
I am crediting, genuinely from my heart, this facility and the people involved in his care. Thank God for their never-ending, relentless energy to not give up.
Welcome home, Dad.
You know, I say that there's probably 4 key reasons I survived COVID. Good DNA, God's will, the prayers of my family, and Maine Medical Center.